Hi, this is Robin Crane-McCallister presenting the Mini-Mental Status Exam screening. The Mini-Mental Status Exam, also referred to as the Mini-Mental State, was developed in 1975 by Fulstein, and McHugh to detect and measure potential cognitive impairment and decline. A full MMSE or identification of sections of the MMSE within an exam when a primary care provider senses something is not right with a patient can identify psychiatric illnesses such as mood disorders, thought disorders, and cognitive impairment. Signaling follow-up is needed with further evaluation. The MMSE evaluates general appearance, motor activity, speech, mood and affect, thought process and thought content, perceptual disturbances, insight and judgment. 11 questions that are used to test 5 areas of cognitive function include areas of orientation, registration, attention and calculation, recall, and language. There is a maximum score of 30, and a score of less than or equal to 23 indicates a need for further evaluation. When used repeatedly on the elderly or hospitalized patients, it can measure changes in cognitive function, signaling a need for intervention. The MMSE is an easily administered tool that takes about 5 to 10 minutes to complete. Dorothea Orum's self-care deficit theory can be applied when conducting the MMSE because of the theory assumptions are that a patient's knowledge of potential health issues will be needed for promoting self-care behaviors. Self-care is dependent on the ability to maintain one's health and well-being, which can be affected by aging and cognitive decline. At the nursing perspective, the way to help with a self-care deficit such as cognitive decline, measured with the MMSE, is guiding the patient towards accepting their particular state of health and learning to live with their specific condition. Orum's self-care deficit theory relies on the self-care needs provided by the nurse, the patient, or both. When looking at studies using MMSE, one study used the MMSE with highly educated patients to detect early cognitive decline with results of a classification rate of 89% in detecting dementia with a score of 23 or below, and the highest classification score of 91% with a score of 27 or below, which had highest sensitivity for predicting greatest risk for dementia. A second study looked at the specific subscales of the MMSE when conducting the test to predict everyday functional ability of patients with dementia. Results of this study, using a 61 participant sample diagnosis ranging from Alzheimer's, stroke, and dementia, showed that the orientation and language domains provided best predictors for everyday functional abilities, concluding that general disorientation and accompanies dementia will impair almost every aspect of the patient's daily functioning. A third study conducted in 90 and older aged individuals with varying levels of education concluded the MMSE overall has good sensitivity and specificity, and that it is appropriate to use with the oldest of old with a range of 82 to 98% diagnostic accuracy. So, abnormal results of the MMSE would trigger the provider to look further into their disease process, such as lab studies, brain imaging, consults to psych, and then education to patient and family of progression and non-curative therapies would also be important. A normal result with the MMSE in an older individual could signal the provider to educate the patient and their caregiver of ways to prevent cognitive decline. Age and genetics are factors that cannot be prevented, but researchers have found that brain health can provide some risk reduction for dementia. Active areas of brain health research include diet, physical exercise, and cardiovascular health. A heart-healthy diet and regular exercise increases oxygenated blood flow to the brain, resulting in healthier brain vascularity. These were all important points to give to family members when you're evaluating the patient. And lastly, you could always refer the patient and their family members or support persons to the Alzheimer's Association for support and education at their website, alzheimers.org.